Through our IA's CARE campaign, we proudly highlight the brave and meaningful contributions of our Iranian American community on the front lines of the fight against the COVID-19 crisis. Tonight's panel is an excellent and humbling example of the tremendous response of Iranian American change makers amid this unprecedented pandemic. We continue to urge the community to complete the 2020 census through our Write in Iranian campaign so that we ensure an accurate count of our community. The campaign website, writeiniranian.com, that's one word, Write in Iranian, has all the information you need, including a virtual training on how to complete the online form. And last but not least, we have worked hard to initiate and secure an unprecedented coalition of 25 Iranian American nonprofit and charitable organizations of the Humanitarian Relief Coalition to maximize capacity for effective emergency response to the devastating COVID-19 crisis in Iran. Without further ado, I give you Samira Burns, who will be moderating tonight's discussion. Samira is a longtime PAAIA member and one of the founders of PAAIA's Civic Engagement Initiative. Samira has spent years working on policy in the health and human services universe, currently as a senior policy analyst for the U.S. Department of Health and Human Services. She also served as a political appointee under the Obama administration. And I turn it over to you, Samira.
Thank you, Layla. We're really lucky to have such a strong group of panelists with us today. I want to first reiterate and remind everyone again to please fill out your census. It's so easy. You should probably do it immediately following this panel while you're still in front of your laptops or smartphones. And it's really, really important to do as it dictates the amount of federal funds that go to your community. So please make sure to do that. Okay, so I'm really proud of the work everyone on this panel is doing to help us overcome the pandemic, and I'm honored to moderate the panel with you. I want to first introduce State Senator Anna Kaplan, who represents the 7th District of New York. She was elected to office in 2018, and she is the first Iranian American and also the first political refugee to serve in the New York State Legislature. Senator Kaplan started her political career as a member of the North Hempstead Town Board in 2011, where she served as the councilwoman of the 4th District until her election to the state Senate. Senator Kaplan is the chairperson of the Senate Committee on Commerce, Economic Development, and Small Business, and is a member of the Senate Committees on Children and Families, Internet and Technology, Judiciary, Mental Health and Development, Developmental Disabilities, Transportation and Women's Issues, and she's also a member of the Legislative Women's Caucus. Next, we have Dr. Ali Nouri. Ali is the president of the Federation of American Scientists. His scientific publications are in the fields of virology, cell biology, and developmental biology. His policy focus is in the areas of science and technology capacity in Congress, dual use of biotechnology, and infectious disease. Prior to assuming his role at FAS, Ali served in Congress advising Senators Jim Webb and Al Franken over a 10-year period. He served in various positions, including as Legislative Director, National Security Advisor, Energy and Environment Advisor, and as a Science and Technology Advisor. Ali is leading the Federation of American Scientists' efforts on a 2-track project to 1, counter disinformation on COVID-19, and 2, help the U.S. Congress develop proactive policies to end the pandemic. We also have with us Dr. Milad Pooran. Dr. Pooran is a physician who has served his community and country as both a civilian doctor and as a member of the U.S. Air Force Medical Corps. Dr. Pooran completed his clinical fellowship in allergy, immunology, and critical care at the National Institute of Health. While at the NIH, he immersed himself in HIV-related research, working with and learning from some of the most premier scientists in the world, including the, I think, very well known to this group, Dr. Anthony Fauci. Dr. Pooran went on to work in the Office of the Secretary for Health and Human Services, tackling national biodefense issues, as well as H1N1 pandemic influenza. Dr. Pooran has over 2 decades in military service and is a colonel in the U.S. UASF and the State Air Surgeon for Connecticut. He has deployed and provided support for flying and humanitarian operations on all 7 continents and served as a combat medic and operational flight surgeon. He is currently a senior partner at and chief medical officer for PHI Healthcare, and is currently the head of ICU at the University of Maryland Laurel COVID Hospital. And last but not least, I want to introduce Ashkan Soltani. Ashkan is an independent researcher and technologist specializing in privacy, security, and behavioral economics. His work draws attention to privacy problems online, demystifies technology for the non-technically inclined, and provides data-driven insights to help inform policy. He's previously served as a senior advisor to the U.S. Chief Technology Officer in the White House, Office of Science and Technology Policy, and as the Chief Technologist for the Federal Trade Commission, advising the Commission on its technology-related policies, as well as helping to create its new Office of Technology Research and Investigation. He's also served as the FTC in 2010 as one of the first staff technologists in the Division of Privacy and Identity Protection, helping to lead investigations into major technology companies such as Google, Facebook, Twitter, HTC, and PulsePoint. Ashkan was one of the architects of the sweeping privacy legislation, the California Consumer Privacy Act, that passed in California in 2018. I want to thank you all for joining us today. We know you're especially busy right now. So after 2 months of the pandemic response and nationwide shutdown, the country is starting to reopen, but there are still so many unknowns, and region by region, state by state, there are notable differences on how the pandemic is impacting communities. So I want to ask you guys a few questions. I want to start with you, Dr. Pooran. As I mentioned, you are the head of ICU at the University of Maryland Laurel COVID Hospital. I can't thank you enough for being on the front line. How are you doing?
Good evening, Samira, John. Thank you so much. We're doing well. To say that we're busy would be a bit of an understatement. Our group runs 6 ICUs in the Maryland, DC, Virginia area, and our volumes are anywhere from 100 to 200% from our baseline capacity of what we would expect this time of year. One of the blessings early in the crisis was that a lot of people stayed home, and a lot of the usual elective procedures, admissions to the hospital were down, so we could really kind of confront the COVID crisis face on. But as areas start to open, elective surgeries come back, we're actually seeing the regular hospitalization volumes pick up, but at the same time, we're not seeing the COVID trends necessarily go down. So it is putting more of a strain on the hospital systems, but I think we've had enough time now where the hospitals, the facilities, the region have really tried to staff up and be as prepared as we can be. Now, there are regional variabilities. So our hospital in Western Maryland has not seen a surge yet. It's anticipated to come. At Laurel Hospital, where I am tonight, we're adjacent to one of the highest zip codes in Maryland, to the highest zip code in Maryland, one of the highest zip codes for COVID positive per capita in the country. And we are seeing this steady plateau, this steady burn where we kind of hit our surge and then we just plateaued, and we have just not come back down from that mountaintop yet. There's different models, and we look at these models very closely with the governor's office, hospital leadership at various facilities, and we try to adjust our staffing models to accommodate where we expect the numbers to be. One of the tragedies of this disease is that on average, when a person goes on life support, when they go on a ventilator, in most of our hospitals, we have them off the ventilator within 2 to 4 days, depending on their disease severity. With this disease, we're averaging somewhere in the 18 to 21 day range. So not only are these people sick, but they're staying on the ventilator, utilizing drugs, resources. And what we're finding is we're running out of precious drugs, we're running out of resources in terms of equipment. Simple things like filters that go on the ventilators have become difficult to supply. So, you know, as a physician, as a leader, we every day have to be cognizant of how we use our resources, what supplies we use. And unfortunately, the death rate remains fairly high from this disease. You know, looking at current numbers based on what we're testing in terms of positivity, we're still in the 20% range, meaning that of all the people we test, we're still seeing about 20% positive. I think most models show that unless you can get this below 10%, you're really not breaking the back of this pandemic. And at this point, we're still seeing about 3 to 6% death rate, depending on the population. In Prince George's County, where I grew up and where Laurel Hospital is located, it's an elderly African-American community. people who worked in the federal government who lived good lives, but now they have high blood pressure, diabetes, two diseases that we're really seeing as comorbidities being impacted by COVID. So patients who have high blood pressure, have diabetes, anyone who's over the age of 50 with these comorbidities are really at risk and should stay safe. They should really take extra precautions to protect themselves, because that's where we're seeing the most amount of fatalities from this disease. And you know, over the last couple of weeks, we've heard a lot about clinical trials for drugs that are coming on the market. Remdesivir just received emergency authorization for use by the FDA. And again, we're working with our pharmacies and our hospital partners to try to figure out how this drug is going to get distributed by the manufacturer. It's going to go through FEMA, through the states, through the hospital systems, and how that's going to get distributed to us at the front lines, and then how are we going to deploy it to our patients. We're optimistic that with some of these drugs, tocilizumab or remdesivir, some of the trials that are going on through Mayo Clinic with convalescent plasma, so plasma from people who've been infected, that we can see some benefit. We've used these drugs anecdotally, there's been some improvement. But again, the fatality rate remains way too high for this disease. And so as the states start to reopen, honestly, we have no idea how this is going to play out, whether this is going to be a slow, smoldering plateau. I think the vast majority of us are planning for a fall and a holiday season coming at Thanksgiving and Christmas that's going to be fairly brutal, not just with seasonal influenza, other diseases, but also with a resurgence of COVID. So we're planning for the worst. We're hoping for the best. We're hoping for the vaccine trials to kind of kick in, get the frontline providers. We have 50 providers in our group, and at last count, I think 5 of our doctors and advanced care practitioners have become infected. So we're kind of following the national trends of about 10% infection rate. We're going to do serological assays for all of our providers come June to really get a sense of how many of our providers were actually infected and exposed. So that's kind of what we're doing. It's a day in, day on. Very concerned about the mental health of our providers, fatigue, burnout, but we're doing everything we can to be there and to protect our communities.
I'm muted. Thank you for that. I can only imagine what you're dealing with. And I actually want to go to Senator Kaplan next, because I know there's a lot of pressure on the states to reopen and on the elected officials to create opportunity for them to open. It's no secret that New York is one of the hardest hit states, leading the nation with roughly 319,000 confirmed cases of coronavirus, about 19.5 thousand deaths. I can't even imagine to begin thinking about all the factors you and your colleagues have to consider when it comes to determining what's next for New York. Can you give us some insight onto how states and local governments are making decisions around which businesses should be open, which ones should be closed, and kind of what to do?
Good evening, everyone. Thank you, Samira and Leila, for making me part of this really very impressive panelist to speak with a lot of your viewers. I welcome the opportunity and I thank you for it. So I have to say, I was in Albany all the way till March 31st, where we passed our budget. And it was about that time that the governor basically shut down New York. But we don't really call it shut down, we call it New York on pause. Because in reality, there's millions of people who are going to work every day. Our doctors, nurses, healthcare providers, transportation workers, grocery stores workers, pharmacists, and we owe them a great deal of debt and gratitude for all the work that they're doing to help us. And I have to say, I'm amazed to see, not amazed actually, I'm not surprised, but it really is amazing to give people, residents of state of New York, 19 million people, give them facts and tell them what is going on and ask them for their help. When the governor issued stay home regulation, and once he was really giving all the information and all the data to the residents, it's really the New Yorkers who really bought in and believe this is the right thing to do. We all want to open up and we want to go back. But we all also have to be very realistic and make some very difficult decisions, some that are not very pleasant. But we have to make our decisions based on facts and data and the health experts' information that is being provided to us. The decision to proceed has to be a very careful and methodical one in opening up. And our first concern is really our residents and making sure we're doing everything in our power to keep them safe. A human life doesn't have a price on it. One death is too many. And really, all the first line workers, all the work that they're doing to help us. As you said, New York was the epicenter for this. And we got hit really hard. And as you mentioned, we have over 320,000 positive IDs. We have, just today, we had 2,786 positive IDs in state. We've tested almost 1.1 million people, and we want to make sure that we are bending that curve, and we have done so, but we need to go all the way down. We still have deaths about less than 300 in state of New York, which is way, way too many. Every one of those deaths has a sister, a brother, a father, a mother. You know, their lives are not, they're important for all of their family members and for all of us. So in order for us really to make the decision to start up, we have guidelines that we follow. And to guide the timing correctly, we have 4 key criteria that we have to look at: the number of new infections, healthcare capacity, diagnostic testing, and contact tracing. We all know that we need more testing. Every health advisor is telling us we need more testing. And unfortunately, that's not quite available yet to the extent that we would like it to be. But we want to see, we test our first responders. We test our healthcare givers. We want to test the people who work in nursing homes. Those are really frontline workers. We want to make sure that we are giving them the tests first, and then of course, all the other people.
Absolutely.
We follow the guidelines from the CDC, which has at least, you have to have at least 14 days of decline in total hospitalization and deaths in 3-day rolling average. I can tell you, I represent the 7th district, which is Nassau County. And if you look at New York, every region is very different. And that's why Governor Cuomo is actually taking a different approach and doing regional approach. Upstate, we don't have this affecting the communities in a very big way. So they probably will have a much earlier start than we will. Mm-hmm. Long Island, we only qualify 2 of the guidelines out of 7. It is really important for us to make sure that we have, at least our hospitals have 30% ICU beds available going forward. That all hospitals have at least 90 days PPE stockpiles so that they can tap into in case we get the surge again, just like Dr. Pooran said, because we just don't know how this is going to be affecting us going forward. We've all made huge sacrifice in the last 2 months by staying home and trying to curb and go down. We want to make sure that we are actually doing the things that are really advisable and not just working with our gut. We all want to go back, to our normal life. But we also have to imagine our new normal, because life will be different after this pandemic. Yeah. This is something that we've never experienced, and it's brand new to us, and there's a lot of unknowns.
Yeah, absolutely.
I also want to say that in order to, we have different phases for reopening. Phase 1 will be including things like construction, manufacturing, retail, with curbside pickup. Phase 2 will be professional services, finance, insurance, retail, administrative support, and also real estate and rental leases. Phase 3 will include restaurants, food services, and hotels. And phase 4 will be arts, entertainments, recreation, and education. The point is to really try to focus and see which group we can open up and build on that and see how that's working and continue. I know this is a very difficult time for a lot of people, but we want to make sure we have the right message going forward. I think people look to their electeds for guidance. And I don't think they want us to come and tell them everything is okay. They want us to tell them the facts, give them the data, and tell them what the health experts are telling us, that what we need to go moving forward. And we want to make sure that once we're into these different phases, we also pushing that information that it's really important. Cleaning, sanitizing is very important. Those are key. Making sure doing the social distancing, wearing a mask. Governor Cuomo actually announced we're doing this whole thing about an ad. They asked people to apply and put an ad about wearing a mask, because there are people here that are not abiding by regulation and they're not wearing a mask. Right. And the point for the mask, it's not just for you, it's to keep other people healthy. You know, we can together work hard, unite, and really defeat this pandemic that we're dealing with right now, if we all work together. And I know I can speak for New Yorkers. As a New Yorker, we're resilient. We've been through a lot worse than this. And we will overcome this. It is really important for all of us to do our part going forward.
Thank you. You brought up contact tracing, so I want to go to Mr. Soltani. Actually, one of the things that we keep hearing about in the news more recently is contact tracing. So many of us don't even know what that is. We've never heard of it before. I wanted to ask you to explain kind of what contact tracing is for us and what should we be cautious about thinking, because I think oftentimes, especially nowadays, we are always like, oh, there's an app for that. And is that really a good thing when it comes to COVID-19? So it's kind of like a two-part question. And then, you know, I know there's a lot of pressure on our policymakers to find these solutions and kind of quickly find these solutions so that we can open back up, go to, you know, whatever the new, quote unquote, new like normal will be. But with the high percentage of false negatives in hospitals, just from the COVID testing itself, you know, there's a danger, I think when we were talking earlier, there's a danger in the untested technology too, right? So what is what is contact tracing for the audience who doesn't know, and kind of what are the dangers or what should we be cautious of when we turn to technology? You're on mute.
Great, thank you. Thanks for having me, and I really appreciate the question. We heard from the senator, and we've heard from a lot of folks that we need data around this pandemic. And the two key pieces of data that we want to know is who is infected and who have they been in contact with. And contact tracing is that practice. It's an epidemiological practice where healthcare providers would interview infected patients to see who they've been in contact with, call those patients, do additional research and interviews, and determine whether those potential patients have been infected or not. And so it's a well-known medical kind of process. There's experts that do it. It's a well-known field, and Dr. Pooran can probably speak to it better than I can. As kind of with the scale and scope of this pandemic and the increased pressure to reopen, policymakers particularly, but people in general are looking for proxies of information for who is infected and who they've been in contact with. And so you might have heard a lot about digital contact tracing. And this is using smartphones, using kind of beacons, other technologies to essentially try to infer or use a proxy of who might be in contact with who. And we've seen, for example, Singapore and China and other countries deploy this, South Korea most notably, deploy digital contact tracing to augment traditional contact tracing. This is basically the people would run apps on their phones that would, for example, monitor either their precise location or emanations from their cell phone, just like your phone is connecting to your Bluetooth headset. It's sending off a signal. Other phones could detect it and detect a unique signal and identify whether two phones have been in contact. So either using location or Bluetooth as a proxy for whether two people might have been in proximity to one another, right? And this was used in South Korea quite well, but it was used in one kind of a privacy invasive way. This practice of contact tracing in the medical context is very invasive. They figure out who you've been in touch with and call and interview and contact those people so that those people may, for example, quarantine or shelter or get tested. So it's an inherently invasive practice in the medical community, but it's something that we trust our doctors that we need to do to essentially block the rapid spread, particularly since there's a large pre-symptomatic period of number of days before you even exhibit any symptoms. So it's important for apps and technologies to do that human process in a almost fully automated way. So we've seen proposals from Apple and Google, but something like 50 other apps have emerged across the world that propose to do contact tracing, basically detect whether you and another person were in proximity, and then, for example, automatically send an alert to you if I either declare myself as symptomatic, as having symptoms, or am tested and therefore can verify that I've been infected and then communicate that to you. And the issue is that a lot of these technologies, these technical approaches are untested. They often are ineffective, particularly because the digital technologies don't have the rigor that the human contact tracers will. Our phones might register us in the same room, even though we're separated by a wall, right? You can see your neighbor's Bluetooth signals. You might have personal protective equipment, or you might be behind a piece of glass, and yet our phones might register us as in contact. More importantly, our phones, if we start to begin to rely on this technology, we don't always have our phones with us. And in fact, only 80%, 81% of Americans have smartphones. So even with full 100% penetration of those 81%, so everyone in that 81% would be forced to install this app, you have issues where you would still have quite a large false negative rate, something like 40% false negative rate. That's compounded by the testing false negative rate that you indicated. And so if we start relying on these kind of untested technologies for things like whether to either stay home or, more importantly, whether to go out, I might be feeling symptomatic, but my app might tell me, oh no, you're cleared to go, and therefore I kind of go out in public. I think that's such a dangerous precedent, particularly since I suspect that even though most of these apps are compulsory as of now, or sorry, voluntary as of now, right? You're kind of encouraged to download them. Nevada, North Dakota, South Dakota, Utah currently all have apps that are voluntary and that you're encouraged to run. I think as these apps gain adoption, you could imagine stores, employers, public transportation agencies, kind of airlines require that you show the output of this app before you're permitted to return back to work or board a flight, et cetera. And again, I'm not against contact tracing. I think it's incredibly important. And I think perhaps those policies make sense if you've been infected. My concern is using untested technology that has quite a huge kind of false positive, false negative rate. And lastly, to speak to some of the work Ali does, it also has a huge potential for abuse. So a lot of the apps I've examined have the ability, for example, to generate on a mass scale these types of alerts, right? So I can essentially generate a cascade of false positives in a certain region based on the proposals that are out. And because of the approaches, they're very hard to mitigate. So one of the challenges is that if we're just using these apps to self-quarantine, maybe that's not a big deal. But one of the challenges is that I could potentially, at an opportune moment, say around an election, generate a mass notification on election day and cause people to question whether or not they should go out. And those types of attack surfaces, those types of potential vulnerabilities are, I think, problematic as we look to this technology.
Absolutely. Absolutely. Thank you. You mentioned some of the work that Ali is doing, and so I want to go to Dr. Nouri next. Ali, I want to get your perspective because you have both the experience of working as a staffer on the Hill and advising your principals, and you're currently leading this amazing project that's aimed at policymakers. And so Congress's role is, more important now than I think it's ever been, but stands at a disadvantage when it comes to something like dealing with this pandemic, because of the 535 lawmakers, only 17 have a background in science and technology. So can you talk to us about the Rapid Response Task Force that the FAS has established?
Sure, I'm happy to. Samira John, thank you for having me. Thank you, PAAIA. It's really an honor to be joined by all my colleagues today who are really doing a lot of tremendous work. If there's really a silver lining here in this outbreak, it's really how people have come together to share their stories, to build teams. And I think everything we're hearing today is really a testament to that. To your question, Samira John, as you said, one of the focuses of FAS, the organization that I run, has really been on Congress during this outbreak. And that may sound counterintuitive because during times of crisis, we don't necessarily think about Congress as leading the effort. We tend to think about the executive branch and all its powers to respond. But if you look at just the last month, the U.S. Congress, it has passed 4 major bills, right? It potentially averted an economic collapse. We're talking about multi-trillion-dollar bills. Now, it's gotten some things right, and it's gotten some things wrong. But going forward, as this outbreak is going to be with us, I suspect for another 12 to 16 months until there's a vaccine, there's a lot more that Congress is going to have to do. There's more bills that it's going to have to pass, and it's going to have to do a tremendous amount of oversight, especially as the administration has been stumbling in so much of its response to COVID-19. And that's not a partisan comment. It's just a fact that you hear Republicans and Democrats talking about that. So there's just much more that legislative body needs to do in terms of oversight. Things like what the senator talked about, testing, right? We were so late in this country to bring testing online. Dr. Pooran talked about what he's doing on a day-to-day basis. He's probably concerned about, do we have enough ventilators? Do we have enough hospital beds? And we heard Ashkan talk about contact tracing and some of those technical challenges in bringing more technology online. So if you think about all those issues, they are all issues that are wrapped around science and technology. And that's really a challenge for Congress because, as you said, out of the 535 members in the US Congress, only 17 of them have a background in science and technology. So how is it that this tremendously important body going to solve this crisis? We don't elect members of Congress because they're scientists or engineers, right? We choose them because they're good problem solvers, because they're good at talking to people on a variety of issues. They tend to be generalists, not technical people. So our solution to this problem is, in my organization, if you don't have the expertise internally, let's get you the expertise from the outside. Right. And we're very lucky in that sense that we live in a country that's really a leader, a global leader in science and technology. And we have experts all over the country, right, doing cutting edge work on these issues. We have a number of those experts today on this panel even. So what we're building a rapid action COVID-19 task force. It's going to be made up of 50 to 100 specialists in science, in technology, in medicine, anywhere from virologists to technology experts like Ashkan, who's going to be one of the members of that task force. And we're going to make these people available to members of Congress, to their staff, both at the federal level, but also at the state level, also at the local level. So I hope Senator Kaplan and her colleagues, to the extent that they need this resource, we'd like to make that available. You know, particularly because in addition to just the expertise challenge, in a time of social distancing, it's really a lot harder for members of Congress to do their job. You know, we had the first congressional hearing in a long time yesterday in the Senate Intelligence Committee, and essentially, you know, staff isn't even present, right? Normally, members of Congress at least augment what they don't have at their fingertips with expertise from that staff. That's become much, much harder in a time of social distancing. So I think it's really important to really try to think of innovative and novel ways to address that gap and address that mismatch. And the more we can recruit scientists from across the country, technologists to address that gap, I think the better position will be.
Thank you. That's really, I think it's very cool as someone who supports some policymakers. I think that's very cool to have access to that. Senator Kaplan, I want to come back to you because, you know, to Ali's point, in addition to kind of, and you sort of talked about this earlier too, with kind of the phases and opening businesses and kind of the decision-making from a health perspective. But I kind of wanted to talk to you about just generally families that are struggling. So, you know, I think we're constantly hearing about people wanting to open their businesses, wanting everything to open up. But really it comes to the fact that, you know, individuals and families are struggling to just put food on their table and pay their rent. And we hear these miracle stories of some landlords paying or allowing delays. The majority are not. And so states have lost a lot of money because of the COVID-19 response. And I think I read somewhere that like the state of New York has already paid out $4 billion in just unemployment benefits since the pandemic hit. Can you talk to us a little bit about kind of the short-term and long-term impact that you and your colleagues are sort of anticipating or planning for with state services, and like what we can kind of expect when dealing with that? Senator Kaplan, you're still on mute.
I don't have my, you have to unmute it for me. Okay, so I have to say, I've only been in Senate for the last year and 4 months. But I have to tell you, this year's budget was one of the hardest budgets ever. We started with a budget deficit estimated at $10 to $15 billion. I mean, and we are, by New York State Constitution, we have to pass our budget. And the deadline is March 31st. So we passed it and thought if we need to make adjustments down the road, we'll make adjustments. As you said, there's a lot of money going out and nothing is coming in. And this deficit will grow even more. And what does that mean? That means cuts to our public schools, means cuts to our police, means cuts to our roads maintenance, cuts to a lot of services and programs that we work with different institutions to provide for our residents. And those are really important programs and services that our residents count on. When I think about United States, I think about United States of America. We all are states, all individually in our own rights, and we have our own laws, but we all chip in and send our money, our taxes, federal dollars to Washington. as I'm sure you've heard, New York is a giver state. If you just tally up the excess amount that New York State has paid to federal government in the last 5 years, it's over 115 billion. And I believe in all of giving. One state does more, helps another state. We're all in this together. And for decades, New York has been a giver. Now it's time for New York to get some of that back. We were the epicenter. We've been hit the hardest here. And we need to get more help from our federal government. And I hope we will. We're also looking for different ways to help and see how we can raise revenue. And you talk about small businesses. I'm actually very passionate about small businesses. Coming from the council seat, I represented smaller districts, 40,000 people. And I saw how small businesses in our mainstreams of America are being affected in this global economy. And they're being hit so much harder now with this pandemic. And those small businesses are the backbone of our communities. They're businesses that are owned by our family members, our neighbors. They're what makes our community special. And we need to help them out. And I'm glad that the federal government reacted and worked really hard and passed 2 legislation giving out funding. The first funding was not really very helpful to a lot of small businesses, but the second funding has been. My first suggestion to any small business owner would be to call up your landlord, to have an honest conversation with them. They have to understand your success is their success. And maybe you can work something out. Beside that, in New York, the governor passed an executive legislation. Nobody can be evicted for 90 days. And that 90 days is the end of June. And nobody can have their utilities turned off either by not paying. My first suggestion would be to anyone who can afford, please go ahead and pay your rent and utilities. If you can't, call up, try to work out a plan with the landlord or the utility companies that are providing you that service. I'm sure they'll be more than happy to help and have that conversation with you. Then the next thing is, you have to think ahead. You have to really think and reimagine your business going forward. We're not going to go back to the old normal. It's going to be a new normal. Come up with different ways that your business can survive and thrive. We have a lot of centers here, federal, that are being backed by federal government, and also EAC centers, economic entrepreneurial centers here in New York, that really can help you and guide you and tell you what you're doing wrong, what you're doing right, and sort of put you in the right path. I just did with my staff, help of my staff, I've done 3 webinars in helping people, and I've brought in experts from US small business and also from New York State Economic Development to answer questions. Those are available on my website. People can just go ahead, open them up and just view them. I hope that there are a lot of questions there that were answered. I think those are a lot of good questions that people have all over, not just state of New York, and they could be good answers. We've tried very hard to be a resource for a lot of our constituents and residents here in my district, but also the entire state, and help them with all their filings and helping them with getting this loans and how they would qualify, and how some of those loans are really grants that could be really forgiven if you meet certain criteria, meaning you keep your employees and pay some of that 75% of the money that you're getting to your employees. The other 25 you can use for rent and utilities and other expenses. There's a lot of good, really, resources. My staff works very hard every day. We put in a newsletter for all of our constituents and anyone who's interested in reading. We're all about facts, giving you data, telling you what our health experts tell us, and science, and give you the right guidance and answers to your questions. There's a lot of misinformation out there. People need to go to a source that they trust. So this way they can make intelligent decisions going on forward with the new ways that we're going to be opening up. And if I can help anyone, please look me up, give me a call. My staff is working around the clock. We're more than happy to lend a hand to whoever we can. It is a privilege for me to be a senator, and I don't take that lightly. And if I can help anyone, really, that's why I'm doing this.
Thank you, Senator. You couldn't have set up my next question better, actually. And I'm going to go to you, Ali, because you have at FAS has actually been busy working on another pretty amazing project. And I feel like, as Senator Kaplan said, there's so much information out there, and there's so much incorrect information out there. Between kind of, there's multiple daily press conferences on the federal level, state level, local mayors and municipalities are having press conferences. There's media coverage on this, social media posts. I mean, it's like, I'm overwhelmed, and I feel like I have a pretty good handle on stuff. So can you talk to us a little bit about this other project that you're doing? You guys have created sort of a resource to kind of filter out the noise. Is that right? And Emily, if you don't mind, can you actually share the screen?
That's right, Samira, John. Maybe I can just talk about disinformation for a minute, and then you can share the screen. That would be great. But you're absolutely right. There's a ton of disinformation out there, and as the senator said it eloquently, there's a real need to get to constituents, to people, the information that they so crave. And the disinformation has been so bad in this case that the World Health Organization actually has a term for it, right? It calls it the infodemic. So we're not only fighting the pandemic, which is caused by the virus, but we're also fighting this infodemic that is also viral in its own way. And if you just look at the couple issues that came up early on in this outbreak, and then again more recently, very basic issues like, where did this virus come from, right? We know from experience, from public health data, that 75%, right, 3 out of every 4 emerging disease has an animal as its source, right? It's typically a wild animal that comes into contact with people, and a virus jumps. That's what happens with Ebola. That's what happens with the initial SARS. That's what happens with MERS. And that's probably what happened with COVID. But very early on, there was lots of disinformation coming from multiple places, both internationally and domestically, pointing fingers and talking about how this virus was actually constructed in a laboratory as a biological weapon. And a lot of people actually believe that, right? And you can't necessarily fault them, because you go online, you go on social media, that's what you see, and it's hard to know who to trust. And that's going to become, a public health matter, because what's happening now is quite a bit of disinformation is starting to spread around vaccines, the efficacy of vaccines. And so, I mean, imagine how tragic it would be when we do get a vaccine, 40% of people, 30% of people refuse to take it because of this information, right? So we really have an uphill battle, and we really need to provide answers to the public. So if you could put up the site now, that would be great. So what we've essentially developed is a site that's called Ask a Scientist. So it's the URL for it is covid19.fas.org. And the site is filled with information from credible sources on the pandemic. So you can go on the site and essentially ask any question you want, and the knowledge base will provide you with an answer. Now, the cool thing about the site is if it doesn't have the answer to your particular question, you can type in your question, and that question then gets routed not just to us, but also to a network of 600-700 scientists who are volunteering their time around the country just answering the public's questions. And it's become so much in demand that both the governor of New Jersey as well as the governor of Alabama have now put up this Ask a Scientist site on their Department of Health website, and it's gotten 4 million views just in New Jersey alone. And so our next step with this project is to try to go global. Right now it's translated into Spanish as well, and we'd like to translate it into at least a dozen more languages, including Farsi, and really make it a tool to bring credible information to people around the world.
That's amazing. Thank you so much for that. I'm trying to watch the time too, and I really want to go to Dr. Pooran again and kind of just ask the simple question of like, what can we do to help you? You and all the healthcare professionals on the front line that are trying to deal with this pandemic, and really for us, right? You guys are saving us, and so I think we actually had a question from the audience that essentially was saying the same thing, but more specifically was asking, if nothing changes and there's no miracles, I think we know the current state of events, but what can we expect if we really aren't going to have any miracles in the near future? What can we expect over the next several months? And, on top of that, my question of like, what can we do? What can we do to help you guys out?
I think that's a really valuable and critical question. I think the most important thing that any one person can do is to keep themselves safe. I think we come up with excuses to not follow social distancing. We miss our loved ones, we miss our relatives. We want to see them. Grandparents want to see their grandchildren. There's a lot of good reasons why we want to be with each other. It's important to humankind, that social connectedness. Most of public health grew out of veterinary medicine. I mean, that's why the term herd immunity exists, right? So a couple of heads of cattle would get sick, and you would isolate them. You would isolate them from the rest of the cattle. Sometimes you would actually go through the draconian process of killing an entire flock of birds, for example, so that it wouldn't spread to other farms. So we learned a lot about public health from veterinary medicine. And so the term herd immunity, for example, refers to the fact that once you hit about 60 to 70% infected and presumably immune population, that the virus will have less targets to jump around on. And so our normal social patterns put us at less of a risk. But just look at New York City, look at New York, look at Maryland, DC, California. In New York, they went from 10% to about 25% of the population being infected. And look at how many people died. I mean, look at the disaster as a society that we had to endure just to get that jump in infection. And so to get to 60%, what are we willing to tolerate? What are we willing to endure? And the hope is that with a vaccine, we'll be able to get to that immunity rate without having to kind of endure the social strain. The best analogy I come up with is we're driving full speed into a concrete wall, right? And the question becomes, if you just say, well, let's not do anything, let's just wing it, then that means that basically you're going to go full speed, no seatbelt, no airbag, and you're just going to run into the wall and you're going to hope everything's going to work out. That makes no common sense, right? So what we do is we put brakes, right? We do social distancing, we decrease our speed, we make sure our seatbelts are tight, that's wearing the mask, we have the airbags in place. We come up with these safety measures that give us a buffer. Because right now, without a vaccine, we're going to hit that wall. We have to as a society. But think about it, if we hadn't taken these measures into effect, if we had hit that 60% within 2 to 3 months, you would have globally lost the entire population of the United States. The world economy couldn't tolerate that. I don't think humanity could tolerate that kind of a loss. So you know, this is not something to be toyed with or taken casually. You know, the lawmakers have a lot of pressure on them, but I think as an individual, we just have to understand this is a bit of a marathon. There will be a vaccine. I have full faith in that. You know, the current vaccines that are under study, a lot of the delivery mechanisms and the base have already been tested in humans, which has allowed us to accelerate this process. So the delivery device has been tested. We know it's safe. We just have to find the right mix. And really, the vaccine will actually give you a better immune response than even with the natural infection. But that's the hope. And so, you know, in an optimistic, realistic world, sometime by this time next year, we'll have that 60 to 70% immunity, both through infection and through vaccination. And we'll be able to kind of start to reemerge from this. Without the vaccine, it's going to take 2 to 3 years for us to really effectively come out of this. It's a marathon. Be safe, take care of yourselves. We rely on our politicians to make sure we, you know, it's like going to war, right? You can't send soldiers to the front line without bullets and armor. We can't go in there without our PPE and our gear. So we're doing our mitigation efforts. If you have the means and the capacity, send lunch to the local hospital, to the staff. I know the nurses really appreciate that. It means a lot to them. You know, there's a lot of platitudes. A lot of people say we support the frontline people, but actually take action, take something. You know, make an effort. It's Nurses Week this week. There's a local restaurant here that's got really good Peruvian chicken. So we're gonna try to take care of the nurses on Friday, and I'm having my dad do the delivery. So, you know, it's little things like that that show our humanity, show our connectedness. Rely on FaceTime and WhatsApp and Zoom and all these other great devices to stay connected to your loved ones. We'll come through this. Humanity will survive. We're just trying to make the stress and strain as less as possible. But thank you for this. And as soon as we hang up, I'm going to go fill out my census. So that's.
Thank you. I was going to end with that. And I do want to be respectful of people's time, because I know that similar to me, you're probably all on Zoom calls all day long and Zoom meetings. So I don't want to outwear my welcome, but I know that we have a few more questions. I encourage everyone to go to covid19.fas.org and ask your questions there. And if the questions can't be answered, as you heard from Ali, they will get an answer for you. I just want to thank all of our panelists. Thank you guys so much for taking the time today to talk to us. We wish you all the best of luck, because from creating the policies to the technology to help support, you know, the recovery efforts, the information and the support to the policymakers and our frontline healthcare workers, we cannot get through this without you guys. We really, really appreciate everything that you are doing to help us survive in this time right now. I want to remind everyone to fill out your census, please. It's very, very easy. I did it in 5 minutes, census2020.gov. And also, please note that we did record this. We will post it next week. And if you can, please subscribe to PAAIA's mailing list so that you can get more information about this and other efforts that PAAIA is making for you on your behalf. Thank you guys so much. Have a wonderful evening. Best of luck to our panelists and everyone at home. Stay safe.
Thank you. Bye-bye.